So I guess approach to a birthmark, and when we covered a lot of it, I guess it starts with having a good understanding of what the type of nevus even is, right? And like you said, the likelihood that it could have some deeper penetration. But I guess for people who just want to know what like the overall options are and when, you know, they should see like a dermatologist versus plastic surgeon.
Most of your dermatology visits, if you have insurance, are going to be covered. So a lot of folks will opt to see the dermatologist first for that reason alone, to have just a spot evaluated. Is it dangerous or is it not? And then at that point, you know, like for me personally, if I think my patient will have a better outcome seeing a plastic surgeon, I'll send them to a plastic surgeon. The first step really is making sure something is not dangerous, you know? And I think even a plastic surgeon will probably, if they saw a patient, would send them to a dermatologist and say, hey, just check this out, make sure it's cool, or send a picture or something just to make sure that, you know, whatever modality they're going to use to treat it is the right way to do it, you know. And then it really depends on the type of mole that it is. So like a raised mole, you know, like I said, it depends on the color of it. That can either be shaved or surgically removed. A flatter, broader mole always has to be surgically removed. There's no like other way to treat it. Even like lasering pigmented moles is kind of like a slippery slope, and you can get into trouble doing that. So typically those are treated surgically. And if it's a larger mole, usually they're treated by a plastic surgeon in a serial manner, where you take part of it out and then let that heal up, then you take another part of it out, then you take another part of it out, just to optimize, you know. I mean, you know better than me, but typically like large congenital nevi are typically treated in that fashion.
But yeah, my preference would be in an ideal world to always have them go to you and just to kind of get that, you know, approval before, you know, going ahead and doing a surgical procedure. Especially because, yeah, I mean, you can start to go through these serial excisions, but then if you're dealing with, you know, malignancy, you don't want to be cutting right through it, you know, and then making that decision of whether or not to do like a punch biopsy versus shave. I just feel like it's better done by a dermatologist.
Yeah, listen, there's some things that we got to send to you guys and some things that we can do, you know. That's just the beauty of medicine.
Yeah, I agree with that.